Hello, everyone, and welcome to From Darkness to Love and Light. Today, I have quite an interesting guest, and I think for me, the when I read her story, it really impressed upon me how depression, anxiety, all of the mental health issues can actually affect anybody, and it can just affect anyone, and I think that just kind of blows my mind is that, when the more educated you are, you kind of feel like you should be aware of these things and how to deal with these things, but not necessarily the truth. Sometimes we need to dig a little bit deeper to get more help. Um, but in short, I will definitely let her explain her whole story. But in short, essentially, her name is Dr. Heather Clark, and she was married to her Prince Charming. But shortly thereafter, everything changed. She became paralyzed by anxiety. She called to God for help, but nothing seemed to come through for her. She suffered from major depression, and it hit her when she was a medical student, along with suicidal thoughts. It all really took its toll on her, and I want to know how it all changed. So, Heather, welcome to the show.
Thanks for having me, Linda.
Oh
Happy
my
to be
gosh, my
here.
pleasure. I'm so happy you're here. This is such an important. I'm knocking things over. See, I told you nothing scripted in my place. Um, it's incredible to think here you are, a doctor, and you should know all the signs, and you should know, in my eyes, right, the things to do, and yet it still hit you.
Hmm.
It's amazing how strong mental health can be and how it can affect people,
Hmm.
Um, so share your story with us. What happened exactly?
So I've survived three episodes of major depression. The story I sent to you was telling the story of my very first one because I think that's the one that really caught us unawares.
Yeah.
My mom struggled with major depression my entire childhood, so it's not like
Mm.
I'd never heard of it or didn't know what it was.
Right.
Um, but it's like you said, it's still surprising that when it showed up on our doorstep, when it showed up in our lives, we had no idea what it was.
Right.
Um, and the way I describe it is looking back, it just kind of creeps up on you, and it's this almost gradual darkening of your
Hmm.
mind, so that it darkens, 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 and then all of a sudden you have these blinders on, and
Yeah.
you can't see anything that hasn't already been filtered by the depression.
Right.
And then by the time you realize you're really, really in trouble, you can't even see or imagine a way out. All of your options are limited. All you can see is just this forever and never ending darkness and
Hmm.
sadness and misery that's never going to end. At least
Yeah.
that's how it feels.
Yeah. I having been through it myself, I totally agree. It's exactly what it's like, and it just you don't have the energy to even
Mm-hmm.
fight it, right? Like you're just like I just want to lie on the couch and I don't want to do anything and I don't even really care, you
Mm-hmm.
know. Yeah.
Yeah.
It's really tough.
And
Really,
like you
really
said,
tough.
it doesn't matter, how educated you are, financial security.
Yeah.
I have very strong faith, had memorized
Hmm.
tons of scripture. But it's an illness. It's an illness just like, Christian can get diabetes or high blood pressure, Christians can get depression. And
Yeah.
I think because there is a spiritual component to mental health where we do
Hmm.
derive so much faith um, from our faith, from others, from scripture. Um,
Hmm.
Sometimes there's this danger of focusing exclusively on faith and scripture to heal depression, and then almost a denial of it being an actual illness.
Hmm.
Whereas the best treatment is coming kind of that multi finger approach. Yes, pray for
Right.
me. Yes, declare scripture. And for me, declaring it out loud made a huge difference. And then, yes, go to psychiatrist, get medication, go to a therapist, um,
Yeah.
come at it from all sides, and that's ultimately how I came to healing.
Yeah. Like, so what happened when it first hit? Like, how did you, get off the couch, so to speak, and actually go and seek help? What did you do?
I didn't.
You didn't. Well, there is that. Okay.
Yeah. So it just slammed us from seemingly nowhere within weeks of this whirlwind courtship and marriage.
Yeah.
Um, I struggled through we got married August 27th, and I struggled through my September rotation. Um,
Mm,
in October, I told the medical school that I was really struggling, and they gave me the month off.
hmm
Um, and my husband was just like, whatever you need, do whatever you need to get better.
mm,
But yeah, if you've been through depression, you know that time alone to sit and think is not helpful.
no.
So I literally would sit in a dark apartment all day, every day,
hmm
and just like rock back and forth on the couch, just brain spinning out of control. And then my husband would come home from work, and he would hold me for 4 to 5 hours while I cried every single night.
It's
And
exhausting.
it's exhausting, and it was this unknown, literally this unknown monster that we had no idea what it was.
Right.
um so yeah, then I tried to go back to medical school in November. um Failed miserably.
Mm,
Lost it in the middle of clinic. The resident was very kind. He literally walked me over to the mental health facility for the medical students,
mm.
and I talked to them, and I was like, I guess I need longer off. And so I took the rest of the year off of medical school from November to
Mm.
June.
Wow.
So I guess I got physically walked over to a mental health facility.
So that's how you
As
got the help.
I mean, doctors aren't the only. We like to pretend like we're superhuman, so until we're
Yeah.
not. And yeah, so I guess that was the moment of, okay, we're
Mhm.
going to the psychiatrist, and we're going to counselors and therapists, and we're going to figure out how to treat this.
Right. And I mean, do you think any part of it was stemming from the whole, you know, medical schooling or whatever, like maybe seeing things? Like, do you think any of that created any trauma in you at all, or
I don't think so. It's
no?
There are certainly situations and things that we go through in our training as physicians that create those circumstances. For
Right.
me, I was in my third year of medical
Okay.
school, so I really hadn't. I had just come out of the book years.
hmm
I did struggle a
Okay.
little bit, and I think that some personalities, and for me, I think this was part of it. I was always really, really good at book work. And then
Mm,
when it was transitioning from book work into clinical work,
mm,
um, probably because I was so used to always knowing the right answer, there was a struggle and a disconnect there for me.
mm.
Um, I would hesitate to jump in and help or do something or say something or suggest something,
Okay.
because I always wanted it to be the right thing and the right suggestion, the right whatever.
Right.
And it's actually really interesting. I noticed that in myself from July to September when I moved into the clinical years. After my break from medical school, I ended up getting a temp job, doing physician credentialing on the office side of things.
hmm
And there was just almost a real world knowledge practicality that I got out of that temp job of, oh, there's not a perfect, form to type up and send these letters to these physicians. I'm an intelligent person with a highly educated brain. I can
Mm.
just type up a letter and send it. And it seems silly when you say it out loud, but for someone who'd just been in school her entire life and, summer jobs here and there, but never really kind of had a day in, day out office job of like figuring things out.
Right.
It was a really important switch in my brain to
Mhm.
know there's not a perfect, nobody has created, this online bank of perfect letter forms or whatever it tends to be. No, there's not a
Right.
perfect way to position a patient for this procedure. You've been highly educated, you have an intelligent brain, and so you figure it out. And
Yeah.
that switch really happened when I was just working a, Monday to
Wow.
Friday office job.
Right. Probably not just not the pressure on you to sort of, look at things like in such a high moving situation or whatever. It was
Mm-hmm.
probably allowing you to look at it a little bit differently.
Mm-hmm.
But
Mm-hmm.
yeah. Oh my goodness.
Yeah, and
So
then
you
episodes 2 and 3 happened during residency.
okay.
Um, um, and for sure, residency is a rough 3 years.
Yeah.
And they've made a lot of changes in the laws, so it's not as bad as it used to be for
Right.
physicians
Right.
who trained before me. Um, but it is a period of intense training and intense preparation. And even if you have an amazing residency who follows the rules and is very supportive of residents, it's still just this very intense time of learning and growth and exhaustion
Yeah,
all together.
exactly.
Yeah.
Exactly. Yeah, it's just nonstop, like,
Hmm.
and I think that's the thing that worries me the most is that I mean, I know a few people that are in the medical field and how, you know, it's so demanding in so many
Hmm.
ways. And the whole point of kind of being in that field is because you want to help others, right? Like
Hmm.
that's what you want to do, but ultimately you can't help everyone, and that takes an awfully big toll on a person, you know, and it frightens me because like you say, like, you're supposed to be strong, and that's whole like the whole aspect of being a doctor or a nurse or whatever is that you're strong and you can handle anything, but you're a human being. You can't
Hmm.
handle
Yeah.
everything, like, and I think it's particularly a field where there needs to be much more awareness on that because there's a lot of addiction and there's a lot of depression and there's a lot of anxiety and, you know, mental health issues that evolve around that field.
Yeah. And we lose a lot of physicians to suicide.
Yeah.
It's We lose a lot of physicians to suicide.
Well, that's sad. It's like,
Hmm.
why aren't we taking care of the people who take care of us?
Hmm.
You know, there
Yeah.
should be more, there should be more direction that way, like,
Hmm.
I don't know. I hope that support gets there at some point because we need all the doctors and nurses and medical staff or whatever to help us in our lives. So what can we do to help
Yeah.
them? Like, you
Yeah.
know,
There are physician coaches out there doing really important work
good.
around these themes.
Mm,
Just off the top of my head, like you said, we didn't prepare anything, but just people that I know in my world. Sunny Smith is a family physician who has a company called Empowering Women Physicians, and she
mm.
she has all the data on burnout and physician suicide, and does phenomenal work with women physicians. There's a
Awesome.
physician named Pamela Wible, Wible, MD, and she does a lot. She speaks out a lot about physician suicide, and I think the other one, his name's he's the happymd.com. I think it's Dyke Goodman. Happymd.com is pretty easy to remember, but
Yeah.
and he kind of starts to address these decisions of, you know, we're humans too, and I think the times that it's the hardest to offer myself self compassion in my role as a physician is when I run up against my humanity, and in my humanness, I make a mistake or I miss
Mm,
something, especially if that miss means that somebody died.
mm,
That is really hard to live with. Um,
of
that
course.
is really hard to live with, and that's something that every physician carries.
Hmm. Exactly. But I mean, you're not perfect. Nobody's perfect. And
The
that's
practice
so
of
important.
medicine. You're like,
Yeah.
can it be some AI perfection? Where's that magical program that I was looking for in medical school?
Exactly. Exactly. Oh my gosh. And so yeah, so what to get on your healing journey, what did you go through then? What did you do to get yourself out of that funk and out of that dark space?
Yeah, so the biggest factor in all three depressions was time. Um,
Okay.
it took me 9 months to walk out of
Mm-hmm.
uh, each depression that got dark
Mm-hmm.
enough that suicide was a danger to my life. It took me 9 months to
Wow.
walk out of it, and that's the first thing that I tell friends or family members or anyone that is going through it. It's
Mm-hmm.
like, get the help that you need, stay safe,
Yeah.
and it's going to take time.
Yeah.
Um, but I got a Christian counselor. I went to a psychiatrist and got on meds. Um, I had my extended break from medical school now. I ended up getting a job. My husband was super supportive. He said, "This is your chance to walk." He said, "If being a doctor isn't what you want to do anymore, if this isn't what you
Mm-hmm.
want for your life," he
Mm-hmm.
said, "Don't worry about the money. Don't worry about the student loans. You'll get a job. We'll pay them off. This is your one chance to walk away."
Mm-hmm.
And after 9 months of, well, I guess it was November to June, so
Okay.
yeah, 7, 8 months of
Mm-hmm.
being away from medical school, working a regular job, you know, in many ways, I just learned how to be an adult and be a wife in those 7 months. I had
Mm-hmm.
gotten married and moved straight from my parents' house to living with my husband, and grocery shopping and
Mm-hmm.
cooking, making food, and just kind of normal daily life adulting. And
Right.
by April, May, June, I was bored. And I told my
Mm-hmm.
husband, I said, I think I want to go back to medical school. And he's like, okay. And so I rejoined the class behind me, and started third
Wow.
year again in June or July, and ended up graduating medical school 3 months early. And we had our first child and matched to residency, and then started residency. And then I fell apart again. So, um,
Oh.
so what did we do? Medication, therapy, scripture,
Okay.
prayer.
Yeah. Yeah.
Um, I those are probably the four basics.
Yeah. So speaking,
Exercise, even just walking, just getting
oh
out and
yeah.
moving to
Yeah.
just to shake my
Just move.
brain loose.
Yeah.
Yeah. Hmm.
Yeah. When you speak about medication, so I would say that I remember I started my medication, my gosh, in 2002. I crashed, and I was always afraid of medication
Mm,
because I was always like, oh, okay, no, this is like it's an addictive thing, and I'm going to become a drug addict or whatever if I go on this, right? Like
mm,
just this stupid thought that I had about the meds. Now, when I talk about it, I'm like, no, no, no. It's just a vitamin for my brain. That's all it is.
mm,
It's just a vitamin
mm,
for my brain. If there's
mm,
no addictiveness to the regular, medication like the that you would take to help with depression or anxiety. Yes, there are some medications that will, in the moment, calm you down or whatever. That can form addiction if you
yeah.
continue on that route, but you don't need to be on
Hmm.
those medications. So You are the doctor from your voice, not mine. Can you explain how these medications work?
It depends on what you're on. So,
Mm,
the most common medications prescribed for major depression are a category called SSRI, selective serotonin reuptake inhibitors. And basically, what that does is say your depressed brain has a serotonin deficiency. Serotonin is kind of the
mm,
happy mood stabilization hormone. And so, what SSRIs do, we have these neurotransmitters in our brain, and so our neurons actually aren't connected to each other. There's a space, and then these little hormones travel across the space and connect to receptors. And
mm.
so what the until they kind of get reabsorbed into the cells, and then they're not in the space anymore. So an SSRI blocks the reuptake pieces so that the
Mhm.
little receptors hang out here longer and activate
Right.
more of those receptors. So you have the same amount of serotonin, but it has a bigger effect.
Mm.
So that's the way that the most common antidepressants work.
Yeah.
More and more research in the recent years have shown that the SSRIs actually treat anxiety states as well. So
Hmm.
these are the Zolofts and the Paxil and the Lexapro, um, that whole category of Prozac, that whole category of antidepressants.
Right.
Um, Depending on what kind of depression you have, or if you have um, a different diagnosis, like bipolar disorder,
Hmm.
there's everyone hears bipolar and they think manic depressive crazy person. That's
Right.
bipolar 1, where there's like super highs and super lows.
Hmm.
Bipolar affective disorder type 2 actually looks a lot like major depression. So you get these little
Hmm.
blips called hypomania,
Hmm.
where maybe a little crazy, but it's more like super happy, peppy, active, not sleeping as much. Maybe some excessive spending, but it kind of sort of makes sense.
Hmm.
Instead of like wasting thousands or tens of thousands of dollars, maybe it's a 300 or 600. Okay. But
Hmm.
then after the little blip of bipolar type 2, you get this deep, dark
Hmm.
hole of depression.
Right.
So bipolar type 2, and even bipolar disorder, responds more to a class of medications called mood stabilizers rather
Hmm.
than the SSRIs. In fact, if a person has the wrong diagnosis of, and if a psychiatrist meets somebody in the bottom of a major depression, they don't
Hmm.
know if it's major depressive disorder or bipolar type 2 in the middle of
Right.
major depressive, because the symptoms are exactly the same. So you
Right.
can get the prescribed depression medications or SSRIs in the bottom of this, and you
Hmm.
won't know that it's the wrong medication until you come out of the depression. And then the antidepressants can send a bipolar patient too high,
Right.
um, and then it's recognized and you figure it out.
Okay.
And so those respond to mood stabilizers. They're called
Hmm.
the atypical antipsychotics, are the class of meds that work really, really well. And those are Seroquel, like quetiapine, uh, um,
Hmm.
I'm
There's so
trying
many
to,
meds.
Geodon. There's a whole class, and they're a lot better tolerated and less hard on the system than the old school antipsychotics, which are like Haldol and lithium and things
Right.
like that.
Right. But
But
with a
then the
typical,
addictive ones that you're talking about is called the benzos. So those are the
right.
Ativans and the Xanax and the clonidine, sorry,
Right.
clonazepam.
Right.
So
Right.
those are the ones that I compare it to an albuterol inhaler.
Hmm.
Um, but albuterol inhalers aren't addictive. But if an asthmatic is using an albuterol inhaler every day, that's their rescue medication. So if they
Hmm.
need it every day, then
Hmm.
it's an indication that their asthma is not well controlled. So
Right.
if you're dealing with depression or anxiety and you're taking an Ativan or a Klonopin or a Xanax every day, that's a
Yeah.
sign that your depression or anxiety is not as well controlled as it should be, because
Right.
those aren't meant to be daily meds. They're rescue meds.
Right. And so with that, in that case, you would just up your SSRI medication. You may be on a too
You go
low of a
back to your
dose or what
doctor and
have
say,
you.
"Hey, I'm using my
Yeah.
using my Ativan every day. What else can we do
Yeah.
to get a hold of this
Yeah.
anxiety?" Hmm.
And that's so it doesn't always mean you don't have to be on a benzo in order to heal, like to help
Correct.
your brain. You can
Correct.
just be on an SSRI. They're just like the benzos are just a little bit extra if it's like really bad, particularly in the beginning, because generally speaking, it takes about
Hmm.
4 weeks for an SSRI to really start to take effect within your system, within your brain, really.
Hmm. Hmm.
So
Hmm.
it's, I think it's just important to hear that from a doctor's mouth because I can say all I want about it being a vitamin for my brain, but I'm just there's so much mental health issues out there right now that it's frightening. It's almost like I swear every other person, if not everybody, is suffering from some type of mental health issue
Mm.
these days. And the help is there. There's so many different forms of help, but this is one of them, and it's not something to be afraid of. It's not going to hurt you, like you can start off low and see where you go, and you may have to change your
Hmm.
medication. Some may work and some may not. Like it just
Hmm.
depends, right? But
Yeah.
it's if that's a fear of yours of taking this medication, like I just urge people to understand that it's not something to be afraid of, like it's no different than you're a little iron deficient. You need to take an iron pill daily just to up your
Hmm.
iron level, like it's just
Yeah,
there's
peace with I finally made peace with taking my medication, and for the
mhm,
longest time it was like, okay, here's my daily dose of humility.
right.
Which probably isn't the best way to think of my medication. But that's kind of, it's like, okay, Heather, swallow your pride and swallow your pill today.
I call them my
Here's
crazy
your
mama
admission that
pills.
you're not perfect.
Right.
But so today I just look at it as, this is the medication which leads me to leave the stable, happy,
Yeah,
successful life that I have. Like, this is the medication that lets me have the life that I want to have. Um,
exactly.
and it took me a while to get there. But I've really made peace with it. I take my medicine faithfully. I see my
Yeah.
psychiatrist every 6 months.
Hmm.
And I've been in a great place. Oh, I'm gonna have to do the math. 13 years now. I've
Wow,
I
good.
Yeah, yeah, yeah.
That's so
But
good.
it's and I just, the temptation is like, oh, I'm doing great, let's come off the meds, and I just see
Hmm.
that pattern repeated over and over. Oh, I don't need them anymore because I'm doing so well. It's
Yeah.
like, no, oh, come. If you want to have that discussion with your physician, go have that discussion with your physician, but don't say, oh, I'm doing so well, and stop the meds on your own, and
Yeah.
my physician, actually, my psychiatrist, he saw me every 3 months, I think, for about the first 2 years that when we moved to town. He was getting to know me, and then he said, okay, let's make sure that you're on the right dose of your medication, and
Mhm.
laid out a plan for me to drop the dose. And I dropped the dose, and within a week, I was depressed and moody, and
Wow.
I ruined Father's Day. And I
Oh,
called my
wow.
psychiatrist, and he's phenomenal. I called in the morning, and they called me back. They said he wants to see you at 12:30. Can you be here at 12:30? I was like, yes, I can. And
Wow.
he saw me in the middle of that. And he's like, and we're going back to the other dose. And in fact, I usually like to have a little bit more margin on that. So if you ever feel like you need an extra dose, I want you to take it, And so
Right.
just a lot of that communication and back and forth.
Yeah.
Um, and then I continuously invest in my mental health. So, um,
Yeah.
I don't see a therapist anymore. I found life coaching in the middle of COVID when I was struggling, and tried several therapists and couldn't find something that connected with where I was at mentally, and an approach that worked for me. And so
Mhm.
now I invested a lot in myself and in life coaching. And then I invested in 2 different certifications and became a life coach myself,
Oh, wow.
so
Good
that
for
I'm
you.
continuously, aware of my thoughts and my feelings and where my brain's at and where my emotions are
Right.
at, and uh, keep getting better.
Yeah. Yeah. That's fantastic. It's just, and that's important to know too, right? Like it's just, we always, we're always going to have to do a little something for ourselves. Like it's just, we can't neglect ourselves. The self-love
Hmm.
is so important. And I think a lot of people just feel like they don't aren't deserving of it. They have to like put their family first or what have you, like put their job first, their family first. They never have time for themselves. And if you are not taking care of yourself, you will not have the ability to do your job, to take care of your family. You have to, it's not
Hmm.
being selfish. You have to put
Right.
yourself first. It's so
Hmm.
important. And I think that that's a lesson, particularly most moms, most women need to remember or need to know, like it's
Hmm.
okay. It's okay. We're no good to anybody else if we're not good to ourselves. But,
Yeah, and as Christians, the better we know ourselves,
mhm,
the better we can connect with ourselves, the better we can show up, connect with God and with each other.
right.
I'm reading a really interesting book called The Gift of Being Yourself. Um,
Mm,
and it kind of has that principle of as we get to know ourselves and realize, get to know our own heart and our own mind, our strengths and our weaknesses, and
mm,
as we show up in prayer or show up with God in the presence of God, with especially with those weaknesses and vulnerabilities,
mhm,
that's where God meets us. And that's
yeah.
when we're stripped of this false pride and our masks and um, our showiness, our
Yeah.
Sunday best is what I would call it.
Right.
When we meet God with um, I think when Jesus was making the comparison, the one who's on his knees, have mercy on God, on me, God, a sinner. Um, that's a prayer that God always answers. He always meets
Hmm.
us there.
Right.
Um, and I had many of those moments through my mental health struggles.
Hmm.
I remember probably one of the most powerful. I was at the hospital where I trained was a Catholic hospital, and they had a chapel in the
Hmm.
hospital, and it was in the middle of the night. I was on call, and I was struggling with all of this, and I ended up in an empty. I was in the empty chapel in the middle of the night, and I was belly down in the middle of the aisle,
Hmm.
bawling my eyes out, and I just kept repeating, God, I don't want this. I
Hmm.
don't want this. And he just met me there with compassion. And it's, you know, like you said, we all have things in our life that we wouldn't have chosen for ourselves.
Hmm.
Um, but that's where God meets us,
Right.
especially if we bring it to him with that honesty
Hmm.
and and let him just comfort us with his presence.
Hmm.
Um, that's what David did. He so many of the Psalms they're so honest and they're so raw, and he starts in very dark places of lament, fear, despair, depression, um, accusation, even against God. And
Hmm.
by the end of pouring out his heart to God, there's almost always this turning of either quieting of his soul or looking upward, or oh yeah, God, you're going to bring justice. Oh yeah, you're the
Hmm.
powerful one. Like it turns.
Right.
Um, and you won't, and then going back, if you're in the middle of a clinical episode of major depression that's untreated, you
Hmm.
probably aren't going to feel the peace, and you probably aren't going to feel the turning.
Right.
Um, but it's there,
Hmm.
and as you start to come out of it, um,
Hmm.
you'll start to hear God and feel God again.
Right. Right. I think there's probably a little bit of there's subtle nudges pushing you out a little bit, too. And
Mm-hmm. Mm-hmm.
Just listen for them and look for them, and you know, you'll be okay.
Mm-hmm.
You know, and get
Mm-hmm.
through it. It's it's a little bit hard, but it's not impossible by any means.
Mm-hmm.
Mm,
And God is with you
yeah,
always. Whether you can see him, whether you can feel him,
yeah.
he's with you. He's with us. He's with me. Um, he never. I love Colton Dixon has a song named "Never Gone," um,
Mm,
and he's. I think the chorus says, "I let go of your hand to make you understand. I was with you all along. I was never gone."
mm, that's beautiful. That's
Mm-hmm.
beautiful. Yeah. Ah, so you are still are you still working in the
I
medical field?
am.
You are.
I
That's
am.
awesome.
I am
Well,
a.
thank you.
I'm a full-time rural emergency physician.
Wow.
Um, yeah,
Hard job, girl.
yeah, and it's
That's a hard
it's
job.
it's such a privilege. It's my mantra in the EI is there in the ER is there go I, but for the grace of God. And
Mm,
it's I very much have a mission and calling um, for service and for medical missions in a lot of ways. I lived in
right.
Honduras as a medical missionary before medical school, and then
Mm,
2 months in medical school. Now I take short term teams down every couple of
mm,
years, and but then in
mm.
the emergency room is its own mission field. I have
Yeah.
this honor and privilege of being with people on the hardest days of their life,
Mm,
and those and that awareness, especially if I'm delivering bad news, whether it's a potential cancer diagnosis or that their loved one has died,
mm.
um, knowing that I'm going to go on to the next patient. And depending on the patient, some of them do stay with me for months or years, but a lot of them don't.
Mhm.
I'm seeing the next patient, but knowing that the words I say and the way that I show up in that moment is going to be
Yeah.
remembered by that patient and that family for years to come.
Yeah.
And just being responsible with that trust and those sacred moments.
Mm,
And I bring my faith with me. So if a patient talks about God or suggests that they have a faith background,
mm.
I'll offer to pray with them,
Oh,
and I'll pray with my patients if that's something that they want. If they say no,
that's
then it's
so nice.
no problem. I just keep taking care of them, um, and then of course I have a soft spot for my depressed patients and my anxious patients, and my suicidal patients of just wow, God, thank you for bringing me healing. Thank you for saving my life several times and allowing me to be here in this moment when
Yeah.
this person needs help.
Yeah. Oh, that's you're special and you are needed.
Thank you.
Um, any, what would be the biggest advice you can, somebody's listening today to this podcast and is feeling at their worst, like when you were at your
Mm,
worst, what are like say three things or what have you that you could suggest that they do right now at that darkest time kind of thing?
you have to tell somebody.
Hmm.
Just one thing. You have to tell
Yeah,
somebody.
good. So true.
I was at my most dangerous, at the closest that I came to dying by suicide. I hadn't told anybody the thoughts that were going through my brain.
Hmm. Mm.
Um, and those are the most tragic deaths.
Yeah,
Someone just,
yeah.
they're here one day and they're gone the next. And then
Right.
everyone who loves them and cares for them, all they have are questions.
Hmm.
And so if you are in that darkest place, I want you to hear that you matter, that your life matters, that suicide is not God's plan for your life. Um, and if you can only, I know if you're in that darkest place, you can't believe me right now. But if you could just hear these words and think, here's somebody who's been through it, maybe she knows what she's talking about. I just want to tell you that life will get good again. If you can just believe that with 5 or 10% of your being, that you help is available, you can get better, life will get good again, even though you can't see it right now. And you got to tell somebody what's
Yeah.
going through your brain, and the next steps will be obvious.
Yeah. Thank you, Heather. Oh, well, I think I could just be on here forever just talking to you about all of this, but I'm
It's my
so grateful
heartbeat.
that yeah, I'm tearing up when you were saying that. It's just so important. I just pray that we um can help somebody who is listening to this podcast today. Um, so thank you so very much for being here. I am just honored
Mm,
that you took the time out of your busy schedule um, to make this podcast happen today. So thank you.
Thank you for your time. Thank you for this platform. I
Oh,
appreciate you.
oh, thank you, Heather. And yeah, I hope this really resonates with some of the people out there. Sending you all so much love and light. Until the next time. Bye for now, everyone.